Okay, today we're going to show you how to prepare for chest tube insertion. You want to open this as sterilely as possible. This area right here, you want to keep sterile. This is the part that's going to be attaching to the patient, and the doctor is going to be retrieving this, and the doctor is sterile. This is a sterile procedure, so you want to maintain sterility as much as possible. Okay, so the first thing you're going to do is fill up this chamber here. So you've already got a funnel attached, and this is sterile water. Tell me when I get to my point, Wendy. We're going to the 0.
Okay.
Okay. And then you're gonna detach this. Maybe. Just kind of let that hang right there for a minute. And then this little gray part right here, this is your suction chamber. So you lift this part up and insert your funnel in here. Then you're going to fill this part to the 20.
Okay.
Okay, and then this part is what attached to your suction.
From the wall?
Yes. And this means that you're open. You don't ever want to turn this knob.
Okay, so at this point, the doctor's going to connect the tubing to the patient after the chest tube's been successfully inserted. So you'll just turn it to where the doctor can reach it so they can get to it sterilely, attach it to the patient.
You're just going to grab that right out of there.
So once that is attached to the patient, what are you going to do for suction?
Well, first you're going to hang, this has little hooks right up in here, which I don't think I can get out of here. Thank you. So these are going to hang on the bed right here. And then you're going to be on regular suction starting at 0, and then you're going to just turn it up slowly till you start bubbling. Aren't we doing anything? There we go. Usually they're going to want about 20.
It's not going to be this active of a bubble, but right now it's attached to the atmosphere.
And you don't ever want to have this just sitting on the floor. If you do have it on the floor, you want to tape it down so nobody trips on it. It's better to have it hanging on the bed. And
What
then,
do you do if it accidentally disconnects from the patient?
if it accidentally disconnects from the patient, you're going to want to clamp and hurry up and reattach a new one as quickly as possible.
And what if the chest tube comes out of the patient?
If the chest tube comes out of the patient, you want to put a gloved hand on the patient and call the NMP as soon as possible.
Or some gauze, Vaseline gauze, right? That
Yes.
you'll keep at bedside if you
Yeah.
have a chest tube in place.
And we're supposed to keep a hemostat at the bedside at all times as
To
well.
clamp the tubing.
And then if we're gonna convert to a wet seal, if the doctor says, or a water seal, if the doctor says it's time, all you're gonna do is come over to the wall and turn your suction off. You don't disconnect anything, just turn your suction off.
And never ever turn
Never ever touch this knob right here.
Okay. I think that is everything.
All right, thank you for watching.